Welcome, everybody. Thank you guys for joining me again today. We're here with episode 2, and today we're back at County General, ready to save lives. If this is helpful to anyone, please like and subscribe and share it with your friends. We'll be prioritizing several patients today. The first patient we have is a lethargic 3-month-old who has been having diarrhea for the past 15 hours. Our 3-month-old looks a little mature, but we're still going to save him. Again, for these, please comment down below who you think we should prioritize. You could just simply put client 1 or patient 1. And then later in the video, I'll reveal who takes priority. I typically like picking out 3 and then going over why I chose to prioritize that patient. Our second patient is a 29-year-old IV drug user who has arm cellulitis. And now we're coming up on our third patient. Our third patient, she just had a coronary artery bypass graft and has a cardiac output of 5 liters per minute. So let's go ahead and comment down below, what patient do you think we should prioritize first? So if you guys need more time to comment down below, you can always pause the video. But the patient that we should prioritize first is the first one, the patient who has diarrhea for a prolonged period. What are we worried about with this patient? Well, the lethargy screams out to me. This indicates a change in level of consciousness, which is an OMG sign. Also, this is an infant, and with infants, they get dehydrated really fast. Not only dehydration, but also electrolyte disturbances because of the diarrhea. Remember, metabolic acidosis, the AS for diarrhea. All right, moving on to our next set of patients. Looks like we have our first one here. This patient is a 65-year-old with sodium levels of 125 milliequivalent 9 hours ago and is confused. Uh-oh, that sounds a lot like hyponatremia. Is it normal to have confusion with hyponatremia? Please let me know in the comments so we can discuss further. But we're going on to our second patient here. We're pulling up on him right now, and he is a 35-year-old femur fracture 1 day ago and is confused with a SpO2 of 91%. And then we finally have our last patient. This patient is 79 years old and has a UTI and is disoriented to time and place. So out of the 3 different patients, which one do you guys think should be prioritized first? Please comment down below so we can go ahead and go over which one is the priority. Again, you guys can go ahead and pause the video to comment down below and review the answer choices. But for this one, if you pick the femur fracture patient, you are correct. One of the biggest issues with long bone fractures is the risk of a fat embolism. And from the low SpO2, it looks like it's traveled to the lungs and our patient here is approaching respiratory distress. Thank you guys for joining me. I hope you guys enjoyed this episode as well. Please go ahead and like and subscribe and go ahead and share that. And I'll see you guys next time for the next episode. Thank you.